Let's learn some of the signs seen in the Graves' ophthalmopathy. The Graves' disease is a condition which is an autoimmune disorder in which antibodies are formed against the thyroid receptor hormone, which leads to hyperthyroidism, and some of the features are seen all over the body. There is an important ocular signs seen in the Graves' disease. This is due to the infiltration of autoantibodies along with the immunoglobulins and some lymphocytes and immune mediators around the periorbital region, which leads to this ophthalmic signs. There are lots of named ophthalmic signs which are frequently asked in all the competitive exam. Let's remember with easy mnemonics. Let's try to remember each of this. The first sign is the cell walk sign. Here, the cell walk sign signifies there will be an infrequent blinking of eyes seen in the Graves' ophthalmopathy. This can be remembered with a mnemonic that here Stella walks. This can be read as Stella walks. When Stella walks, everyone stare at her without blinking their eyes. So Stella walk sign, which signifies infrequent blinking of eyes, which is seen in the Graves' ophthalmopathy. Next, moving on to the other named sign, which is Jelenic sign. In Jelenic sign, there will be an abnormal pigmentation of upper eyelid. This can be remembered as gel ink. Gel ink pen. Ink pen causes pigmentation. So Jelenic ink causes abnormal pigmentation of upper eyelid, which is seen in the Graves' ophthalmopathy. Next, moving on to the other named sign, that is Mobius sign. In Mobius sign, there will be a convergence defect or disorder in the motility or mobility of the extraocular muscle. It is called the Mobius sign. This can be remembered as in Mobius sign, the first few letters Mobius here signifies motility. So motility disorder or mobility disorder of the extraocular muscle is seen in the Mobius sign of Graves' ophthalmopathy. This picture shows weakness in the convergence. When the patient is asked to look at the near objects or your finger, they can't converge, or there is a weakness in convergence, which signifies Mobius sign positive, seen in the Graves' ophthalmopathy. Next, moving on to the other sign, that is Enroth sign. Here E stands for edema. When there is an eyelid edema, it signifies Enroth sign positive. This is a picture showing edema around eyelid. E for E stands for Enroth sign positivity in Graves' ophthalmopathy. Next, moving on to the other sign, it is Geoffroy sign, which signifies lack of wrinkles in the forehead on the superior gaze. This can be remembered as this is a cricketer Indra Roy. She does not have any wrinkles over the forehead even at the superior gaze. This also can be remembered that Roy family in India, they doesn't have any wrinkles over the forehead. So Geoffroy sign signifies lack of wrinkles in the forehead on superior gaze. Next, moving on to the other sign, it is von Graff's sign in upper lid lag when the patient is asked to see downwards. This can be remembered that when you are the one person, one can be written as one. When you are the one person, everyone lag behind you. So the upper lid lag when the patient is asked to see downward is called the von Graff's sign. The opposite to this is Griffith sign. In the Griffith sign, there is a lower lid lag when the patient is asked to see upward. This can be remembered by the popular anime villain whose name is Griffith. The Griffith with the villainistic look, he looks upwards. There is the lid lag at the lower eyelid. So it signifies Griffith sign positive, seen in the Graves' ophthalmopathy. Next, moving on to the next sign is Gifford sign. In the Gifford sign, there will be difficulty in eversion of upper eyelid. This is the picture showing normal eversion of upper eyelid. This eversion will be difficult in patients with Graves' ophthalmopathy, and that sign is called the Gifford sign. This also remembered with the last letters, that is Ford. Ford branded cars are very difficult to afford. So difficulty in eversion of lid is seen with the Gifford sign. Next, moving on to the next sign is Dalrymple sign, which leads to the retraction of upper eyelid. The Dalrymple can also spell as wrinkles. When there are wrinkles or retractions of upper eyelid, then it signifies Dalrymple sign positivity, seen in the Graves' ophthalmopathy.